I'm going to talk about our study entitled Disparities in Cancer Risk Management Among BRCA Carriers Across a Diverse Sample of Young Black, Hispanic, and Non-Hispanic White Breast Cancer Survivors. So, BRCA mutation carriers have a much higher lifetime risk of both breast cancer and ovarian cancer. And among individuals who have already had a breast cancer diagnosis, their chance of developing a second breast cancer in their lifetime is much higher than what we would see in the general population, particularly in those diagnosed at an earlier age. Now, the options for cancer prevention and early detection exist in these women with a BRCA mutation. And mainly, this encompasses both breast cancer risk management as well as ovarian cancer risk management. For breast cancer risk management, what we have are both screening options as well as surgical options. And then for ovarian cancer risk management, our main option at this point in time is surgical, because screening has really not been shown to be reliable. And it is very important to think about the benefits of detecting a BRCA mutation. It's not really about getting them tested, but it's actually, the health benefit arises from doing something about that, doing something with that information. So among young Black, Hispanic, and non-Hispanic white breast cancer survivors, our study objectives were to compare receipt of BRCA testing as well as uptake of preventive surgery among the subset that were BRCA mutation carriers. So we recruited these participants through our state cancer registry, and these women were breast cancer survivors diagnosed at or below age 50 between the years 2009 to 2012. So in our sample, we had 440 Black women, we had 284 Hispanic women, and we had 897 non-Hispanic white women. So what we found with receipt of BRCA testing was among our Black women, 36% had received BRCA testing at the time of study recruitment, compared to 62% of the Hispanic women and 65% of the non-Hispanic white women. And even after we controlled for meeting high-risk criteria based on national practice guidelines, socioeconomic status-related variables, as well as provider referral, we still had significant results, meaning differences between the Hispanic and white women compared to the Black women. When we looked at differences in cancer risk management practices across the three groups, again, what we saw in terms of bilateral mastectomy was 68% of the Black women had had bilateral mastectomy, compared to 85% of the Hispanics and 94% of the non-Hispanic whites. But again, mastectomy is not the only form of appropriate cancer risk management for breast cancer. So we also looked at the additional proportions that had screening. And that brought us up to 86% with the Black women, 100% among the Hispanic women, and 98% among the white women. We looked further into our data to see among the Black women, there were 4 of them that had not had cancer risk management either through bilateral mastectomy or screening. And 3 out of 4 of them were still in treatment, so they were too early to have screening. So it'll be interesting to follow these women over time. When we looked at rates of salpingo-oophorectomy, this is where we saw 32% of the Black women had had salpingo-oophorectomy, compared to 85% of the Hispanics and 71% of the non-Hispanic whites. And even after we controlled for age, time since diagnosis, income, family history, and insurance, we still had statistically significant results between those that were Hispanic and white compared to the Blacks, where the rates were lower. So in conclusion, our data suggests that young Black women with breast cancer are much less likely to have BRCA testing, and among the subset that has a BRCA mutation, they are less likely to undergo risk-reducing salpingo-oophorectomy. Now, it is important to remember that our findings require confirmation, given that even though we started from a large sample, there were a limited number of carriers in our study. And the study was a snapshot in time, so it will be of interest to see over time what happens with these women and if there is an improvement in their cancer risk management. Now, it is also important to remember that BRCA testing and options for cancer risk management are a choice, and there are many factors that play into this choice. So we really need to understand the reasons that these women are making these decisions. Are they being given the opportunity to make an informed decision, or are there other factors that are playing into it where they're not getting the information that they need? And I think what our study highlights is a need to ensure access to testing as well as cancer risk management practices across all populations. Thank you.